They're live.
The annual budget committee of the Vigo County Council is back in session on Monday, 28th of July. The first office up will be the Vigo County Coroner. Good morning, Donna.
Good morning, good morning. I'm here this morning. In our budget for next year, we had a couple increases. One of them was in autopsy. We started out with $215,000, and Dr. Myers, our caseload this year has been pretty high. As of today, we have 132 cases. 110 of them have been autopsied. We figure last year we had 261 coroner cases, 173 were autopsied, and we're kind of on target with the months that we have left. We will hit over 200, I'm sure. We asked for an increase in the autopsy budget line. We started out with 215, and Dr. Myers asked for 265. For next year. But I've come across some information, Regional Hospital, which we pay them $250 for the use of the morgue on each autopsy we do. They are going to increase that for next year. I'm not sure exactly how much, but we're probably looking at around $450 per case, which was $250. But I have not really talked with them yet. Dr. Myers has been talking with them. So that would be an increase there. We did not increase anything else in our budget excepting office supplies, which we had 1,500 and we did increase that to 2,000. Toxicology did stay the same. We're pretty good in that as of now, we had $30,000. We started out in there in 2021. We still have 21,000, so we should be okay in toxicology. The only other line item we have is our coroner dues, and that's $450, and that's always been the same. So there was no increase in that. We have had a pretty good caseload this year. We have had a total of 6 homicides this year. We have had, let's see here, we have had a increase in our suicides this year also. We have had 21, and we have had, we have had 12 suicides. We have had 21 deaths due to overdose. So that is a big increase there. Transportation is the same. It's 140,000 started out this year. We did not increase that, but as of today, when I checked our budget, we have $59,000 left so we have paid out over $80,000 in the last 6 months. Yeah. But we did not increase that. You don't know how that's going to be. I mean, it may be, Curtis is our transportation person, and Monday, we had 4 coroner cases. So, I mean, you could have, there's no way of knowing, how that's going to be. But our main increase was in autopsy, and actually, I don't know how that's going to turn out now with Regional Hospital is going to increase the use of the morgue. I don't know. Dr. Corey is retiring. Dr. Adiagbo will be taking over for him. I don't know what his plan is, whether it's to increase autopsy fund or not. Dr. Corey has not increased his autopsy fee. I don't even know when the last time he did. But I don't think Dr. Adiagbo is going to, but I'm not sure on that. And there's where we are.
Let me ask you this, with the new variant in the COVID, you know, that gives you a real,
Yes,
unknown.
yes, that is an absolute.
If it flares up, I mean, we could really get.
That is an absolute unknown there. And overdoses is extremely high. I mean, you know, it's the opiate addiction is very high. You know, a lot of those maybe pertain to accidental. Some of them are intentional. So in all those cases, you know, they absolutely have to be autopsied. So the
That was gonna be my question is there some things that are, if it's undecided, then that it is automatically an autopsy? And
Yes,
the
yes.
Suicides are.
yeah,
automatic?
suicides are autopsied.
And the overdose?
Overdoses absolutely are. So then again, you know, we're paying for the autopsy. The toxicology has to be sent out.
Okay.
That varies, you know, and depending on charge, you know, but it pretty much stays the same. We use 2 labs, NMS labs out of Philadelphia and AIT, American Institute of Toxicology in Indianapolis. So those haven't changed much in their prices.
Don, explain that, because we have 3 new members of the council here, when is an autopsy performed?
That's very, thank you.
Yeah, an autopsy is performed, of course, if it's a child, if there's been an accident. If a person has not seen a physician in 3-4 months, if it's unwitnessed and there's no real medical history, of course, all homicides, all suicides, unless it's a witnessed, say it's a gunshot wound and it's witnessed, you know, somebody, you know, tries to talk somebody out of it, but they do that. Sometimes an autopsy, it'd be rare that one would not be done, but toxicology would absolutely be done. That's mandatory to see if there's anything in the system or anything like that. If a person is found at home and they're up in years, there's no, the home is secure, there's no forced entry, there's nothing to indicate that there's been any type of suspicious activity. There is prescriptions that is able to be looked at and seen what they were taking. So in an incident like that, you know, an autopsy would not be warranted. If a family member has any reservations, 95% there will be an autopsy done. We've had that happen where, you know, they feel that, you know, they may have overdosed on medication. So toxicology is always done. And if a lot of people, you know, will say, we want an autopsy done, but it has to fit the criteria, you know. And we've had a couple people that, you know, was adamant about having one done. It did not fit the criteria to be a coroner case. So in a case like that, they have to have a private autopsy done.
Oh, that's what I was.
But most of the time,
Pay for it, or
they have to pay for it, and they have to pay up front, because too many times
you know,
a pathologist has done one and the family doesn't like the outcome, so they don't want to pay. And that's happened with Dr. Kaur before. So he does not do private cases, neither does Dr. Adiagbo. Of course, COVID patients are not autopsied. You know, the facility, they don't have the airback facility to do that here. But there's underlying conditions in that case anyway, you know.
if I can, I got a couple questions. One, and it's maybe a bad question, is it, but are we tied? It has to be at regional if they are going to 100% increase on, or from 250 to 450, not quite double, but does it have to be? Do we have to be at regional?
Well, we'd either have to be there or we'd have to send them out. Union Hospital does not do them.
Well, that was my question.
Yeah.
I just didn't know, you know,
No.
because it seems like that's quite an increase. I understand that there's cost increase, but that's
Yeah.
substantial.
Well, and I'm not positive sure on that, but I will look into that because I just found out about it.
Yes, yes.
But
And my other thing is, I'm aware that only do to the race, that how many out-of-county autopsies are performed? Is there a revenue stream for that when we do out-of-county autopsies? Do we get?
Well, we don't pay for that.
So I didn't, that's what I'm getting
Yeah,
at, is
no.
I didn't know if, what these increases are, these are just the county ones, or if there's other ones. That's what I.
Yeah, no, we don't have anything to do with that. Any outside county autopsies.
Okay. So
Only
that's-
Vigo County,
okay.
yeah.
If we send autopsies out to be done, I mean, we gotta wait.
Yeah, we do,
Right, yeah. So
Yeah.
I just knew that they did others, but I just didn't know, but our coroner doesn't have any part of it. It's just the Dr. Ford does the.
yeah, they,
That's what I
you
was
know,
trying
they
to make sure.
would, if Dr. Cora does do the surrounding counties, but that doesn't have anything to do with our county.
But I just remember during the election process, that came up a discussion about it, and I thought, well, how'd that really affect our coroner if they're doing all these other autopsies?
Yeah, no, it
Like
doesn't affect
15
us.
counties bring their cases to Vigo County.
Yeah, they just do because of Dr. Cora, because he,
If we do send an autopsy out, like in Tuscaloosa or Evansville.
yeah, if we send one out, we normally use Bedford, Dr. James Jacoby. But his price for an autopsy is around 1,500, could maybe be a little bit more. Then we have to pay double for transportation to take him there. And then our person is tied up until that is completed and has to bring him back. So we don't, unless it's just a dire need that we have to, we don't send them out. We haven't sent any out. I don't think any this year.
Okay.
Yeah.
Would you say, obviously COVID deaths, that's been an impact, but, and I don't know if this is speculation or if you can say this, but like the amount of overdoses and suicides and things, are those rates, they seem significantly higher?
Yeah,
do you
they're-
believe there's a tie to, I'm just kind of thinking about if there's, we have some money, I don't know if there's some things we can do with COVID funds and that or not.
Yeah, it's a little bit higher. It's not extremely high, but over the last couple years, the overdoses have increased,
It's been going up anyway.
has gone up. Yeah.
And
and-
that's affect our
Yeah.
justice too.
Yeah. But our budget, I can tell you, I've been here a long time, and they used to see my face every other month in the council, because when we first started out, we got $15,000 in autopsy. And now we have 215,000, and, we're running, well, right now in autopsy, let's see, we have about, we have 72,000 left in my budget. Yeah, and see, out of that, we're paying the autopsy fee, for Dr. Cora. We're paying the use of the facility, and we're paying. We've had to do, which comes out of my autopsy fund. This year, we've had to do 3 positive identifications. So we've had to send out to the state police lab in Indianapolis to get positive identifications on 3 different people in the last probably 5 weeks. So that comes out of autopsy. It's not just, there's quite a few things that comes out of the autopsy. Yeah. So basically, of course, toxicology is all toxicology, but in autopsy, it ranges, there's different things that we have to pay out of that. So it will lower that amount, and like regional hospital. Now, actually, really, that sounds like, if you're saying 450, and it may not be 450, but we're paying 250 now, and they have never increased it for the use of that facility to do that autopsy. I'm sorry.
In 32 years.
No, it's never been raised. For that, the use of that facility, because if we didn't have that facility, we're going to pay a lot more to send it out.
Are those overdoses, do you have any idea, like are they younger people or just?
Yeah, they range, in age, to 20, 20 years old, to, 75. Same way, like in suicides. I mean, we have suicides that, we just had a gentleman, 95 years old, and then, one 14. So, and I work very closely with Team Mercy and Christina Christ and the Mental Health Association, Myra Welke. She's the executive director of there, in working with them and trying to, you can't figure out, I mean, that's something that you can't go back on that once that's happened, but just working with these families, because I see every family of every corner case. And, it's heart-wrenching, and what do you, they come to my office and they may be in there for an hour. They may be in there for an hour and a half, and they may come back 3 times a week or 3 times in 1 week, so, we work very closely, with the families in types of situations, not just suicides, but all of them, whether it's natural, the loss is great. And, so you have to, help them as much as you can in understanding this is what happened. And especially in a suicide where, what they're going to say, because I've heard it a million times, well, no, because a lot of suicides, they give you no indication. I'm working with a mother right now, that her son committed suicide, and on Mother's Day, and they had gone out that day to the Red Lobster and eat dinner. Nothing, absolutely nothing for this young man that went home and then hung himself. So,
Well, I have a counseling background, and my thesis was in grief counseling and work with suicide. So I appreciate all you guys do.
yeah, it's
hard. I mean, you guys
very
are
hard.
Probably some of the first people that our families, no matter how the person dies, but especially in cases like that.
Mm-hmm. Oh, absolutely. Yeah, absolutely. I mean, we've had, in the last week, we've had, we just had 2, 3, 4, we've had 5 interstate deaths, and working with families, one's from Afghanistan, trying to get the things they need to get him back to Afghanistan, so it's a multi-task there with one family, and then we have, 1 year, I was trying to think what year that was, we had 287 corner cases. It's the most we've ever had a few years back. That's my story.
On that note, I would like to commend Donna on the job she does and the families that she works with, because there was an unfortunate evening that Julian and I had worked late about a year and a half ago, and Donna had already left the building.
Oh, yeah, yeah,
And we had a mom come in, of a young person who'd been in an accident,
accident.
and she had to get here, and unfortunately, Donna was already gone. Of course, I tried to call Donna, but Julia and I spent about an hour with her just trying, because we were afraid to even let her drive again.
Right,
And she
I
was
mean,
so upset. So I commend Donna for
What-
what she does on that. But I do have one question,
mhm.
and this might be for the members. I don't know if it's still, you and I have talked a while back about autopsies in the prison.
Yes.
Would you like to touch base on that? We do autopsies for
We do,
the
and,
federal prison with no reimbursement.
right,
Throwing that
and
out there.
Well, they were.
And Dr. Myers is going to address that. Dr. Amos tried to, we work with the prison, and they want to request, if an inmate dies, they want an autopsy on every single one. Now, that has changed somewhat, because if a person is in there and they're transported to the hospital and they're on life support, and, we've had that happen many times. and an autopsy is not warranted in that case, just because they're an inmate, but their mental health is documented, and they've got, it's just a matter of time, so those aren't, but there was a time period where autopsies that were done in the prison did pick them up. It wasn't a lot, but they did. And then all at once they changed and they said, since it's a coroner case, we don't feel we need to pay for that. But they do. They have $100 million in that prison. And that is going to be addressed, that if a prisoner does die in there, and an autopsy is warranted, then they need to address that with the
Are
bill.
they contending that they're county residents? Is that what they're saying? Or,
They really, I tell you,
Change
working,
of administration.
yeah.
Within
Within the prison is
You think there'd be laws on that?
Well, that's what we had talked.
See, when the wardens,
Not us,
a lot of it, I think, has to do with the warden too. The warden that we had at one time, or the warden the prison had, he was comfortable in paying for autopsies, but see now, the new warden came in and, they said, well, that's not our responsibility. Well, Cheryl and I have always thought it was. I mean, we have, and so has Dr. Amos and Dr. Myers. We have talked, and she is going to address that with the prison.
Surely if they're on death row, we don't have to do an autopsy.
No, see, that was another thing, for this year, we had, we had 3 inmates, that, died, well, 2 in January, 13th, 14th, and 16th. Those were 3 inmates and they were not autopsied. There was no autopsy done on that. I do a report through my office, a coroner verdict report. So, that's all they're going to get on that, and a death certificate. Now, see, a lot of times families say, well, they always want to, well, something happened and we want an autopsy done. But, in these cases here, I mean, what happened. We have a deputy down there because, a coroner really doesn't participate in that because of keeping life, not taking life. So, 3 of those this year were inmates, and then of course the other 3 were
I'm sure they're wanting to do it for
not.
liability reasons, so they can find a fault.
Yeah, and that's
Sure.
Suffering and all that.
Yeah.
that's absolutely the case.
I understand their desire for it, but.
Yeah, but
they
we
can
don't.
play.
Yeah, Cheryl and I've
Really,
talked
there
about
should
that
either
many.
be a law across
many
the board for all
times.
federal prisons,
Right.
or they either pay or they don't.
Do we count
I
them on
mean-
our census? So if we count them on our census, we
That's probably where they're-
may be liable for it.
Well,
You get what I'm saying?
yes, I do. And, I work with them at the prison. There's a couple down there that's really good. Holly Bowman is excellent, and I work with her a lot. But it's up to the staff, the warden, so,
$100 million for Christ's sake.
oh, they got tons of money. They got tons of money down there. Yeah.
Or either the federal government budgets for it, all of them, or they don't, and they run across the board to say,
On the fees at regional, those are just for autopsy cases, is that correct? The $250 fee?
Yeah, just autopsies. And then,
So
of
like
course,
those inmates, if they're not.
Oh,
having
no,
an
no.
autopsy, then-
no. And then, of course, we have to pay Dr. Core. Of course, we didn't pay him when he was coroner, but now he's not coroner. So, and he, honestly, I mean, he has saved this county hundreds of thousands of dollars in doing autopsies. Well, when he was coroner, he just did them, whether there was 1,000 or whatever. But since he's not coroner, we pay him to do it, because if we had to send him out, I mean, and then again, too, families, I mean, you don't get your reports, for like 2 months, and that's unheard of, because I get people calling me every day, if it's been the next day, you know, they're not going to get a report that quick, but they're going to get it. Yeah. So it's just, and you know, you don't know. I mean, you know, you may have one day, and just like I said, you know, Curtis had 4 Monday. So it's just,
Is there a corners, that the citizens participate in, corners inquest or a corners committee here that works with, I didn't know if there was.
we have 4 deputies, and I'm in the office, and then of course the coroner. So that's our staff, you know, and they're on call Sunday at midnight to the following Sunday at midnight. And I can tell you, you know, they do a terrific job in what they do, and they have never gotten a raise. I mean, they make, they make about 80 cents an hour.
Things people don't know, for instance, if an individual gets hit by a train, the deputy coroners go up and down the tracks and pick up pieces of human body until they have the weight of a person that's listed on their driver's license.
I've done that.
And so, you know, at midnight or 2 in the morning, in 95-degree heat. And I mean, welcome to the coroner's world. And, you know, and it's a confidential thing, that's why.
Well, I just
public
knew-
doesn't participate.
I just know there's sometimes if there's cases, there's corners that
Well, we do. Yeah, we do. Yeah, we do. Yeah, my deputies do that. We do that. Yeah.
Well, I appreciate it. I
It's an
have limited
interesting
knowledge on
office.
corners.
Well, you don't see me as much anymore as you used to. I mean, asking for stuff.
Sure.
If Curtis would happen to retire,
Hmm.
Then everything goes to the devil.
do you expect transportation costs to go up?
No, I don't.
You don't?
I
Okay.
don't. Mm-mm. I really don't.
I expect the bodies to pile up. I don't know who's gonna do
Yeah,
that.
because I'll tell you, he's, well, you say irreplaceable. People, you know, people get replaced, but he
police
is,
department
he
will.
is a big, huge part of this coroner's office. And I can't imagine, you know, not having him.
He does it by himself. He carried a body down 4 flights of stairs.
Yeah.
400-pound body.
And he's there. We used to have a removal service, and, you know, they was good, but they got to where, you know, it'd be 35, 40 minutes, an hour. That's unacceptable. You know, Curtis gets a call. I mean, he's there, you know, just in 15 minutes, and he knows every location that I've never, if somebody, I've been out before and I've had to call him, Curtis, tell me where you are, you know, or what it's around, you know, to be able to find the residents.
If
And,
you have a child, you know, who has hanged himself, you know, you gotta have somebody there immediately.
oh, you got
To
to,
remove that.
yeah.
I'd say it's a special type of person to do it. At 17, I got a call from a neighbor, his wife, and he had hung himself. And so I went and cut him down at 17. And I kind of decided then I probably didn't want to go that line. But he was a longtime neighbor and he had suffered.
And it just happens, you know,
Yeah,
it's,
you don't understand what they're mind that they're in when it happens.
right, you just can't, you know, I mean, I've never told a family I know how you feel, because I don't. I know I lost both my parents. I know how I felt, but, you know, families, they just need someone, you know, that just talks.
Well, we had an inquest on that when I was a kid, so I just.
A lot of people will come back just to see my office and how, How it's changed.
Well, I actually was gonna ask you offline there, I'd like to come and see.
oh,
I'm just inquisitive.
Brace yourself.
yeah. Yeah. We get to talking about all kinds of stuff, you know, so it kind of, it's an outlet for me actually. And I know what it is for them. I've talked with families that, years ago that I still talk to. That'll just come by my office if they're, if they're in the vicinity. So, you know,
I'd like
it's,
to come while I'm alive.
yeah, you want to come, yeah. Yeah, because you never know when that's going to be.
No, you don't.
You don't. I mean, from day to day, it's a day to day, you know, it's a day to day thing. So, you know, it's something we can't change. And I truly got to believe, I know it says you're not supposed to question, but I know I do. But there's a reason why things happen. And somehow families, you know, they've got that, they get that inner strength of somehow, and they, you know, they keep on going.
Just like this weekend, that poor family lost a child.
Oh, yes,
Awful, you know,
Terrible.
all
absolutely
grieving.
terrible.
And
you
you
know,
know,
but-
hate to see it, but everybody's grateful it wasn't their family.
Right, right, yeah.
Well,
Okay.
that's it, we'll do that.
Okay.
When we do salaries.
Okay, got it.
Okay, well, anybody got any more questions for Donna?
Thank you though for everything.
Yeah, thank you.
much.
Okay,
Moving along.
Right after the rainy day.
Have the next one.
I worked in the 80s. So it's a really small print one, but it's right after the rainy day or.
Judy, can you get Todd a guide?
He's the one that helps me.
Well,
Yeah,
here we also have things in between that just have that thing that said that department and all their.
Well, and I found it, I looked at it last night.
But we didn't have time to.
I know, I was just going over it last night, so I already knew where it was, so I was just giving them a heads up. But I couldn't find drug court last night, I looked.
It's not in there.
Yeah, I
So no,
found
it
it.
wasn't.
No,
Adult, no, adult, I
We
don't
don't.
for adult probation.
Oh,
We have
nurse.
to do it
Yeah,
anyway.
right after the rainy day is where I had it, before adult probation, DOC, then there's adult probation.
Number 6, actually, in the gray, in the gray.
So you changed
I changed it all up.
Or purple or whatever.
Yeah.
you wanna call
What we
it.
tried to do at the front is your general fund. It is so hard to decipher on how to do your books.
No, I'm
We've
not-
done it.
No, I'm
All
not very
different
criticized,
ways.
I just looked, and so, before we sat by each other, I showed her.
I found it, yay.
Try not. Right on time.
Where's my help?
Adult probation folks,
Yes.
ready to roll?
Right, you want us over there or just here?
And just go up to the podium.
On the podium, okay.
Have a microphone up there for you. Good morning.
Good morning, how are you?
I need to get her a pop.
Can you see me? Hi, I'm Leanne Riesenbeck. I'm the chief from Adult Probation. So here today to talk about our budget request. So, as far as our best budget, or I guess, do you have questions, or do you just want me to go into?
No, just go in.
Okay. So, as stated in our letter, our budget estimate for budget form 2 for 9120 adult probation DOC grant was no changes. We've maxed out on what we can receive on that grant. So it's a total of $64,575. So no changes to that. And also in regards to our supplemental adult probation, I submitted Form 2 based on the last 11 years of what we've received in probation user fees. So we anticipate that should be the same, so about $100,000 for next year. Although that being said, we have changed how we collect fees, so we're now accepting them online. So our fees have increased greatly. Back in March, we received $24,000 in 1 month, and that's the most we've ever received in a month. So we're hoping that trend continues. In reference to adult probation general fund 0274, I did request a couple changes. With the audit being conducted, we learned that we were submitting claims to line item 36100 printing. We should not have been submitting to that. We were putting copy paper and such to that line item when that's truly only supposed to be for printing, such as business cards, nameplates, that type of thing. So I've asked that $1,500 be moved from printing to our office supplies. as I stated last year, we're still kind of learning what our budget is going to be. 2020 was the first year that we've ever had a budget separate from the courts. Before, probation was always part of courts. So we're still kind of learning what we're going to need to operate. And I don't feel like 2020 gave us a true idea because with COVID, there were so few people in the office. So I pretty much based our budget off of what was submitted in 2020. I feel like after this year, we'll have a better idea of what our operating expenses will be. I also asked for an additional $50 for our bond insurance due to a rate increase. And I also asked for $1,000 more in service agreements, which would bring that line item to $6,000. That pays for our copy machines. We have, our department is separated, so half of us is in one part of the building, half's in the other. The copier that I'm asking to pay for is for 5 probation officers, our pretrial department, and 2 drug screeners use that as well. So that's an increase of $1,000. In reference to our 2100 supplemental fund, that comes from fees collected for probation user fees. I'm requesting that $8,488.20 be appropriated to pay for the salary of our DOC grant funded officer. As I've stated, we've maxed out the fund. The grant will pay only $64,575 with his pay increase next year. This will just cover his increase of pay and fringe benefits. I'm also asking for $500 to be designated for incentives. We've been working with the Office of Court Services and trying to develop our evidence-based practices for probation. And we've now created an incentives and sanctions program that will be implemented next year. We do have a one-time grant of $1,500 that the Office of Court Services granted to us. So I'm also asking for $500 to help pay for the incentives that we'll be using. And I believe that's
Can you
it.
explain that to me?
The incentives and sanctions, yes. It's an evidence-based practice. We've actually changed the way we're supervising our department, and that has just been implemented this year. We're still, in fact, transferring over, but we're changing how we supervise. So whenever someone comes to our department, they're now meeting with an intake officer who does a risk assessment to determine what their risk is. High and moderate risk offenders will be supervised more intensely. So then they will transfer to a supervising officer who will create a case plan based on what has been identified as their criminogenic needs based on the risk assessment. Then once they've entered the supervision phase of their probation, we will incentivize them on how they do as far as trying to encourage pro-social decisions. Like I said, focus on what their specific needs are. But we have a plan in place. So for example, if they're on time, if they're honest, if they're following through with treatment, if they're doing those type of things, they earn points. Those points will be utilized where they can purchase something from our incentive store.
That's what I thought it was going.
Yep.
I just wanted to make sure.
And it's kind of based on how the problem-solving courts reward in their programs.
I see a revenue sheet here, and
So I had actually met with Bill, I don't know, it's been a couple months ago, right?
Yes.
So is this, kind of what you're talking about, is this some of the, that was more dual diagnosis, is that separate from?
Well, it is, but it isn't, because what we're doing now is more uniform across all of the programs.
Okay.
Probation came on, started to use rewards and sanctions, which was always something in incentives that was part of community corrections. So when the courts did the unified process and created the structure the way it exists now, that was one of the challenges to me, was everyone be using those across all of our programs for uniformity and consistency. So we're all basically doing the same thing now in all the departments. We're following the same format of stuff. Oh, I'm sorry. Okay. So, no, we're following the same format at this point as far as uniformity and incentives and sanctions across all of our programs. Yes, Maria, it is used in the dual diagnosis group, but it's also used with just the standard people in residential or home detention as well, just like what Leanne's doing.
Well, and I've read some, it's best practice. It's,
Yes, it is.
We use that in a lot of different, and even incentives and different programs that, I've worked with, so.
Corrections has been slow. I say slower. It took corrections longer to buy into the best practice philosophy. With community corrections, it was, I say, forced on us years ago by the DOC when they decided to start using it. And now through time, it's flowed into the other parts of corrections, probation, parole. Everyone is finally realizing that, to change behavior, affect behavior, then you have to have a process of rewards and sanctions we've always been really, really good at punishing. And now we've learned how to be much better at rewarding them and not just punishing. So
my question would be is when I came and visited the community corrections, so is adult probation based out of there and with the intake, or how does that work? I don't understand it all. I guess even seeing it it's kind of so much, but when you say you have intake, is it there at the same facility or?
Right. We are designated. We have 13 total probation officers. 3 of those officers are going to be designated as intake officers. So we actually just started this 2 weeks ago. So now our intake officers are actually in court. So when someone is sentenced, they're there at court. They meet with them right away, go over their rules of probation with them, and then set up what we call an intake appointment. So they're not in secure like jail or in the work release program. They're free on probation. So our intake officer will meet with them at their first appointment and we'll do a risk assessment determining what their risk level is. So we then know how they need to be supervised.
So if their risk is high enough, are they wearing the one of the 206 that's wearing the monitors?
they could be, yes.
Could be, but not
It
necessarily.
depends on how they're sentenced by the court, either straight to probation with Leanne's group, or they could be sentenced to community corrections if they're deemed a higher risk, higher need. Then that's where they end up in the residential program or on a bracelet. But then sometimes Leanne does have people that may start out on probation, and if there's a violation or a problem, they may put them on a bracelet with us at that point. They're still under her probation department, but they'll be wearing a bracelet as well to try to modify that behavior without sending them back to jail or prison. The courts will use that as a step up with probation.
So your offices are housed where?
We are on the second floor
So
of the
you're on the
community
second floor.
corrections.
Yeah, okay, so you're there, but on the second floor.
Yes.
Correct.
I just trying to understand it.
No, they're on the second floor, yes.
Thank you.
Anything else?
Thank you.
All right. Thank you for your time.
Did we hear from the Veterans Assistance Service?
He said he'll try and get down here earlier, but he has an 11 o'clock appointment, so he thinks so.
We're going to take a little break and see what happens.
And so is health not there either.
Here's your health.
Health.
Never mind. Well, we got 20 minutes.
Yeah, so they're, I mean, if they're scheduled for 11, that'd be cool.
Yeah.
The break too, though.
I'm trying to wrap my head around this stuff.
Jim,
Jim, I have a question. So, and I know it's still kind of up in the air, but as we're hearing some of this stuff that could potentially be impacted by some of those COVID funds, I mean, where do those decisions come from? I mean, is that coming through the commissioners or?
First step is commissioners have to, you're talking about the ARP meeting.
Uh-huh.
First step is for the commissioners to adopt a plan for the use of those funds. And it goes to the council for appropriation.
Now, if we see something, through this budget process that we're like, hey, that could have some potential, is that our responsibility to reach out to the commissioners? I mean, I guess that's what.
shoot, you can do whatever, throw it out there. Good luck.
They're
And I think good
they're
luck.
getting suggestions from.
From everywhere, yeah, I know they're getting hit up even with like nonprofits and.
Yeah, well, just like we talked about the parks, was, for example, and talked about that money could definitely, you brought it up, Jim, I believe that could be used for outdoor spaces. And that seemed, well, logical. And that's, so I've been making notes that that's a possibility for that money to be used, but I wasn't sure how the process worked either.
How much did we get total again? I feel like I know.
What is it? 20.3
Seven.
million. 20.7, yes.
Yeah, and then the city got like, what, did they get
30, they got 30.
30, and then the school corporation additional.
I think they got like 38.
Yeah, we have to do a lot of.
We only gave you so much in advance, so we only got like 10.
Yeah, we get half of it. We got half of it this year and half of it next
Oh, is
year.
that how it is?
And it has to be spent. Is that the one that has to be spent by a certain time too? And then like in a couple of years or something? Hi Travis.
He likes to think he's an ninja, we saw him.
It's sad to see all the excitement that goes on.
Oh, yeah.
We got sunlight today.
Yeah, it is.
Travis, did you see the article on the Indy Hotel in the paper today?
No, I haven't, no.
It's interesting, you're gonna like it,
Okay.
Holman Restaurant, and know what they said, I kind of skimmed it.
honoring the Holman family and all that business.
Oh, that's awesome.
And it's 141 Washington Street in Indianapolis.
You know, it's like, they got some neat new, like boutique hotels, like what is that Bottle Works or something, I saw it there.
They've got that one out there by, Keystone also.
Oh, yeah, that
Karen
one
Works
was cool,
building.
yeah.
Yeah,
I've eaten there. They have a Ruth Chris, I believe, in the first floor.
Yeah, yeah.
I've eaten there.
It's really expensive to rehab those kind of buildings, but it's really neat when they get done with it. They,
It's protective for attracting people to come.
Well, we looked
Yeah,
at
a lot of
it,
people
that was
like
for
it.
wedding reception, that's why I looked at both their names when we were looking for wedding reception locations.
if you're westbound on 70, heading out of town, there's a reception hall on the right that's an old factory building. That, and you can see the lights are on at night when I go past on 70, I always see it, it always catches my eye.
Where is it, like, how far?
It's, west of Illinois Street and everything, so it's before the old Airport Expressway, whatever it's called now.
And there was one called.
St. John's. or-
Yeah, it's before the
Oh,
Sam
yeah,
Jones, so
yeah,
it's
that was-
really before, it's right around that, it's before the area that burnt a couple of years ago, that big factory that burnt. So it's between there and Illinois
I wonder if
Street.
that's one of the original ones they looked at. They looked at one too, it's called, it was something Millworks, I'm getting confused with the mill here locally. But it
No,
was-
I think
it's
you may
in
be right, it
Noblesville-
may be
Noblesville.
Millworks or
There's
something
one
like
up in Noblesville, but they're gonna have a small one at Rick's Boatyard.
Yeah. No, I think,
Do I get to stand?
You do.
Do I get to do it in opera?
Yeah,
Oh, we were hoping.
it depends on how good you're at it.
so they, used to have one in Milwaukee that's like that, it was a textile, and 4-story. and then the
Oh,
other
okay.
room had a mural.
Even better.
There's a mic
If
there,
I
I
was,
guess.
Hello.
I always said before I got married, I wanted to be single and live downtown in a building with exposed brick
Oh, yeah.
and just, exposed ductwork. I always thought that would be really neat as a single person. I think that would be, or recently married with no kids, no pets, no anything. I think that whole atmosphere, I think the downtown atmosphere is
I'm
really.
telling you, Riverfront's got some, I haven't been
I was in
those are
Carmel.
cool.
I was in Carmel and had an injection in my back a week ago today, and we went and ate in Old Town, and Carmel's a really neat city. They've got a lot of neat things going on, so.
They do.
All right, where's my good old health department?
So it's on down from where we just were I got 1168, 1159, so it's about, I'd say about 57 pages below that, I guess.
See health donation,
Should be before that.
you got a lot of health
It
tabs.
should be before all that.
Yeah, we have a lot of budgets we prepare.
It's important that I've learned this
What's
year.
number 1159, 1168,
Got it.
41.
11:59, May, and I start,
And it's really the general health fund that I want to address. I'm Joni Wise, the administrator for the Vigo County Health Department. And I wanted to address the request that we put in regarding the environmental health position that is currently on the local health maintenance fund. This is a fund that I've been here since '97, and we receive the exact same amount every year, about $72,000. And it's based on population, and it used to be what was called the tobacco settlement dollars. So through that grant or fund, we were able to fund 2 full-time positions. Many years ago, we paid for the positions with the local health maintenance fund, and we paid for benefits and insurance off of the general health fund. And then they all moved on to one fund. The fund has slowly dwindled. We've robbed Peter to pay Paul to keep it going for years, to keep the 2 positions. And this will be the last year that we're able to do that, 2020. And so what I'm hoping we can do is move the position, or the environmental health position. I got a moth up here bothering me. Environmental health position to the general health fund. I went ahead and copied for you the different things that the environmentalists do. But I also want to bring to your attention, most of these positions were eliminated in the first 2 years that we, I'm sorry.
I was gonna share.
Yep, I've got a couple extra copies. And I'd hate to eliminate another position, and I would challenge you to see if there's any other departments that took that great of a hit on their staffing. When I tell people, and when I'm in meetings in Indianapolis, that we only have 3 full-time nurses for 100,000 plus population, they think I'm pulling their leg. And I hate to, again, lose another position.
This is good information.
It is.
And you had a lot of information here I read last night.
Yes, because I wanted you to see all the different things that the environmentalists do. Most of our divisions are relatively large divisions. They're actually larger than some departments. Our vector control is larger than building inspection or area planning. It's our environmental division, bigger than both of those 2, but the divisions themselves are larger than some departments, and they are tasked with more responsibility than a lot of departments. Each one of those positions are valued, and each one of the positions we lost were valued.
Let me just say, Tony, as well, I think, going through this COVID catastrophe that
Yes.
we're in, people have to see the value of health department now if they're ever gonna see it.
Thank you.
You can't pull the plug on health department.
From 1900 to the year 2000, Americans got 25 extra years of life expectancy. Only 5 of those are from modern medicine. The other 20 are from public health. And when we work and work well, people don't know we're here. They don't really know what we do. And I think COVID did bring us to the forefront, even if we didn't want to be, and people want to send us back to the dustbins of history. We'll relish that and just do our good work.
And now our mortality rates, life expectancy has got shorter.
It did in the
By
last
what?
year.
4.5 months?
Yeah.
Something like that. So, yeah, I think you've had some really good documentation, and you've done your homework to present the case.
So when and I know Calissa and Jim could speak to this better than I can, but when the property tax cap occurred, the council had to start planning ahead because our county, just like all the other counties, took a huge hit. And one of the strategies they used was if they could do buyouts, or if a position was vacated, it was removed from was not replaced. And that's what ended up happening with ours. With people either took buyouts, or it's hard to keep nurses because it's a competitive field with the private sector, but we really took a hit.
And then you had your projected revenue on there as well.
Yes.
So we just had this discussion earlier before you came in, but there's a possibility health department, more so than probably anything else, would think would have some impact from possible revenue from.
That's a covered
the
time.
COVID
Sure.
stuff. So, I mean, I don't know how that all is gonna
Sure.
work out. But I'm sure you have other asks besides the salary or the position, right?
Ask out of our budgets for this year. Any additional asks that are always at the end of our budgets in red, and we do a narrative justification for them.
Well, I guess I was talking about the ones that the budget request for vector control, is that,
Vector control, I think they looked for some maybe new equipment and some vehicles. And if you've never been to our compound, I will totally want you to go up there. Brendan took a picture, Commissioner Kearns, a picture of himself in like a 1980 Ford that still runs perfect. That came from us because they do a great job maintaining all of our vehicles and then doing their work as vector control specialists. And each week we get those little things from the Indiana Association of Counties, is that right? And I looked over all the different ways that the funds can be spent that we'll have coming into the county or that are already here. And there are things like lead abatement, which is something that environmentalists do, but there's so many different ways that we need to be creative that have the greatest impact with those dollars. We're doing the same thing as a school board with all of our ESSER 3 dollars that are coming in.
Did I just read recently that we have some cases of West Nile? Did I read that?
We had
wrong?
the
And
first
that-
positive
that's what I
samples
was
in the
thinking,
state.
That we were in Indiana. And
Uh-huh.
is that-
We usually get them in July. It's just kind of rare that we get to be the first ones that have them. But we have surveillance traps all around the county, and each day we get 50 mosquitoes out of each, and we send them to the lab to monitor where we have West Nile.
A lot of mosquitoes this year.
A lot of rain.
A lot of rain, wettest June in forever.
let's take.
Not in forever, and that's
Yeah.
a long time.
Really long time.
So if you can, give me a little summary of why we have all the different health tabs and how that all comes together.
We have our general health fund
Okay.
through Indiana code that you have to put money in our account.
Sure.
Off of the tax levy. And then we have the local health maintenance fund that I was talking about. We have the local health trust fund, which again was tobacco dollars. They just call it a different thing. We have our immunization grant that's through Indiana State Department of Health. We have, should be one more. Donation fund.
Donations.
The health donation fund.
So no changes on those other ones, that you've seen anything that would need change on those?
No, no changes.
I was telling
Those
Dawn,
basically just depend on what salaries or increases are given,
Right.
or if there are, and
For-
then it's a kind of a, like Joni said, we take from one to pay benefits of the other person, and
For the two people that are on the local health
Yeah.
maintenance fund, we just had to piecemeal benefits.
just so you know, the auditor's office does do it, but it is kind of a pain on payroll.
And then, and something too, that this is just me because I don't know everybody and I can't read most of their handwriting. And so if the department heads had their name printed by it and then they signed it, that would be appropriate. Because I don't think you're Dan or Dave or whoever. It doesn't look like.
It's the Dr. Brown.
Dr. Buchan,
Oh,
so,
Dr. Burton. So see there.
so as the health department, Dr. Buchan is our health officer, and we operate off of his standing orders. So any medication, death certificate, birth certificate, anything that we do is based off of his medical license.
Okay.
And so that's my little ratty
Yeah,
JKW
I
next
can
to it.
make out your initials. So
But that would be good to know who prepared the document.
that's just something.
Nope.
Just my perspective.
I agree.
That I just hadn't, when I'm looking through this, I'm like, I don't understand.
Next to you, know.
Yeah,
It's
you're
on
probably right.
TV
Just,
all the time.
just
Yeah,
being
it's on
the-
this
yeah.
morning, I think.
yeah, I didn't. That's what I thought, but I'd always heard your name associated with them. So
I'm the administrator, so I do the day-to-day operations.
Sure.
Well, and Johnny, you know, on a personal level, I know you've kind of been on both sides of it between your school position and what we have here and the thousands of kids and teachers that we have in the schools. And I just have appreciated, you know, I know Dr. Brockton has worked with us as well, but being a part of the COVID task force, I've appreciated, I mean, we have.
Thank you.
We're all gonna, and I have to feel like we're gonna be working, I was hoping we'd not be meeting as much, but it looks like we'll be.
We are.
Still rolling a little bit more, so.
And the good thing about our relationship with the school corporation, you know how you check the weather? A lot of people check the weather every day. They check in with us every day and they ask us hospitalization rates, vaccination rates. What are the cases? What do the cases look like? Are they inmates? Is it from the FCI? That we use so many different indicators to move forward with whatever decisions are made at that time.
And just helping train a lot of us and
Yes.
just learn a lot. I know Dr. Coleman too, so.
Yes, thank you.
It's just been really helpful. You guys have worked really hard this year. How many contact tracers did you guys, I mean?
Have at our peak,
Uh-huh.
gosh, New York Times just asked me this the other day. They actually chose our county to interview on our COVID response. So
Oh, my gosh.
I know. I think it was 36.
I was thinking it was quite a bit.
And that's when we had the surge last November and December. That was really a scary, scary surge.
And then where are we now?
We only have a few. They're all flying the nests. Most of them were grads or had finished their undergrad, and we're doing a gap year between either med school or graduate school. So I think right now we're down to 4. So I'm going to have to start recruiting some more people as the numbers are going up. We have 37 cases today.
Do we have as many testing? You know, I mean, a lot of people now are, it seem like they're, you know, either they're getting it and they're just kind of.
There was a lull, and now the testing's starting to pick back up again.
And my office just had a case and, the only one that wasn't vaccinated. And so, but when I asked, I said, do you know if it's the variant? When they find out the test, do you know if it's?
They're just randomly
the variant?
choosing people.
Okay,
we-
so they don't, the test
no.
doesn't resolve yet. They
No.
tell you if it's a
And
variant or
it's
not.
random surveillance. We were talking about that this morning. We did a 10 o'clock. Can you hear like all these statistics regarding Indiana and, how much of the variant is responsible for the positive cases? That's really not accurate because the way that they're surveilling is just randomly picking out one. So
That's,
if you don't give us your methodology, I'm not going to believe the numbers that you give me.
and that, I get that.
How about from the hospitalization of, people now?
They're going back up. Union
I mean,
had,
But to get the variant from the hospitalized people,
say that again.
if they take that variant from the hospitalized people, they're saying that the people in hospital are from the variant.
That's
That would be okay.
we keep hearing that, but again, if you're not testing that individual, then how do you know? And they're not testing everybody that's in the hospital. So I don't get it.
So they're doing the same thing and they're just.
Yes. It's just a random sampling.
So it's a different test.
No, it's the same
variant's the
test,
same.
but I don't know how they genome it out.
How do they just
Decipher.
decide whether it is or
Right.
it doesn't? Okay.
In Union and Regional at one point over the summer, they got down to like 0 cases. And like Union this week was back up to 18 and we had them as high as 100 in there. I just don't want to get back to that.
Unvaccinated people,
Say that again?
are they unvaccinated
Yes.
people?
They're unvaccinated at
I
both
think
hospitals.
I had read, or maybe it was in one of the meetings, 97% of the hospitalizations are unvaccinated
Yes.
people right now.
Now that
They're
one,
saying
they
nationwide.
probably can verify that. It's easier
Right.
to tell which variant, so that one is the one.
Well, I hope, I'm trying to be optimistic that, I definitely don't want you guys to go back to what we had to experience last year. That was-
It was terrible. There was a meeting yesterday with a couple of the commissioners and human resources, and we talked about different things, just starting the dialogue on how things might look if it goes south.
How'd that go?
It went well. It really did. It was a pretty productive meeting.
And what do you think about the future of masks around here?
I think that you have to keep it in context, and as individuals, we need to consider our own risk level. I don't anticipate us going back to masks in the annex and really the courthouse, because there's so many of our county employees took the vaccine. and there are a good percent of our population is vaccinated. But again, it's looking at what is our cases, what are our hospitalizations.
What about kids, under 12?
Again, kids have different receptors than us as adults. When they come in contact with COVID virus, it manifests in their gastrointestinal system. And so they're less apt to cough and spread it. Where with us, it manifests in our respiratory system, and we're more apt to cough and spread it all around. And I know that there are some trials in place right now for younger children.
How much of Idaho's population is vaccinated?
I think we're at 45%.
Yeah.
And then you can go on the map and actually look at it with zip
Statewide
codes.
are we 47?
I think statewide about 47. It may be at 50.
Okay.
But that 50 maybe has their first dose, but not a second one.
Are we stuck there? Or
I don't know. You know,
I
I
would
think,
say at the beginning of the summer it was around like 40 or
it doesn't
something.
seem like the promotions are going.
And, well, the ones that wanted it got it first,
Yep.
so that was the easier ones. The ones that are on the fence aren't getting it, and probably almost like community corrections, we're gonna have to incentivize it.
yes.
I mean, I hate to say that.
We got some funding that we didn't apply for that just like showed up in our email on a Friday evening for $221,000. And it's to promote the vaccinations and to try to hit those hard to reach populations like homeless, incarcerated, which we go to the jail anyway each month and give vaccines. But just really trying to use media, not traditional, non-traditional means to communicate and get information out. But I will share a little interesting factoid with you. One day I was looking at my old PowerPoints and I came across one from 2005, and it was from the CDC on pandemic flu. And it was interesting how prophetic it was on laying out just like how things have gone during the COVID outbreak. But there was a page in there and it talked about novel viruses. And it stated that we would have a vaccination within 6 to 8 months. And I hear a lot of people say, well, they just made that too fast. They don't know. Well, we're talking 2005, it said 6 to 8 months. And this is 2020, 21. So I don't understand where there's that, using that as an excuse not to get the vaccine.
And if you're a Simpsons fan, they had a COVID outbreak on Simpsons.
Did they really? Oh, my.
Yeah, and then they picked it up.
Well, every Monday we do
My
it.
kids are, I'm not.
A Simpsons fan.
That's a lie.
Who gave you your keys when nobody else would? You did, Mo. But yeah, each Monday, we used to do a daily briefing every day at 10 o'clock and go over all the different cases. And some of the elected officials were there. School corporation was there, ISU. And we've now got it down to Mondays. I don't know if we're going to have to start increasing those meetings, but if you ever want to pop in on one, they're really eye-opening.
They're giving away tuition at some
Yeah, I saw that.
universities if you're getting a drawing.
Yes.
I don't know.
They're not giving away anything,
Well, they're making, and I think it's tough to do it now, right before they come back. They're trying to do it before they come back too.
Yes.
So that's hard to reach.
And that's one of the things we're looking at. The two people that are coordinating the grant are at the chamber right now. And Marion County has offered us their mobile vaccine unit. And we would like to kind of partner up and like on a first Friday. I know that Connie that owns the Verb has talked about doing a shot for a shot. So just trying to look at some out of the box ways to reach younger populations.
I have an idea on that. Connie give away the shot, and then you give away the shot. She gives.
Well, she'd have to give them a voucher for the shot because I don't want to give anybody a shot.
I would say, right now, 18, 19-year-olds.
Right, I said that. I said the same thing.
I actually got, I went to lunch the other day at a restaurant here in town, and a guy with us that was younger, he got carded, and he ordered iced tea and he got carded. He
Yeah.
goes, are you serious? I mean, I just ordered iced tea. He said, well, this is a bar, just to be in here if you're under 40. And she said, and these two people look like they might be excise.
To you?
Yeah.
Excise.
That's what I said. So we were all drinking iced tea.
Yeah.
I mean,
Oh,
this
yeah,
what happened,
that's
just,
suspicious.
yeah, that, I think that's probably it.
I got carded the other day.
If
And I
you're-
said
if
to them,
you
I'm
look
57
under
years
the
old, you can make a belt out of me.
$40
Why are you carding me, kid? Is your eyes that bad?
Well, see, if you're how old?
57.
If you say you're 57, they know you're lying.
But I thought to myself, you could make a belt out of me. You're carding me? What's wrong with you, kid? Like, seriously.
Yeah, so she was real apologetic. And he was 37, so I mean, he
Yeah.
was under 40. He looked 12. And, you know, so I get it why she carded.
Sure.
But then the part about me looked like excise, I
Like exercise.
I don't
I
know
wouldn't
what
go
they,
out drinking with you.
Yeah.
Nobody ever didn't drink.
yeah. I'm gonna start acting like it now.
I need to see your ID.
Drinks for everybody.
I just found out that I must be still young at heart, because you said the young kids get the more stomach and, well, you realized when I
You
had
had
it,
it?
that's what I had. And when I ended up in ER, the doctor said that was more unusual, they had just started seeing it.
Yeah, well,
Delta variant.
No,
That's been a while back.
Over.
That's what the stripper
I
had, who
ended
stripped while she was symptomatic. Who gave it to the other stripper, who gave it to the bartender, who gave it to the bouncer, who gave it to the DJ, who gave it to the COs from all kinds of institutions that were here celebrating executions. So we have a name for that, but I'm not gonna say it in a public meeting.
That wasn't me.
I'm telling you, when you get,
What I heard was you got it from a stripper.
when you listen to some of the cases,
Young ones that get that.
but when you listen to some of the cases and the stories behind them, you're like, you're making that up. And it's like, nah, you can't make this stuff up.
So, Joni, the one thing I would like to ask, like, as the council, if things do, and again, you know, for all of us, and especially for thinking of teacher sanity and families too, but hopefully things won't get crazy. But if they do, please keep the council, you know. posted,
Absolutely.
And don't hesitate to send us, you know, information, because we know,
Sure.
I mean, obviously there was a lot of cost and things with what you guys had to deal with last year, and, you know,
Yes.
clinics and extra staff and so on, so. But gosh, I hope we don't go there.
Me too. But you know what? We've made it through everything except mass fatality. We're on the cusp of it last November. That's the only thing, but anything that comes our way again, we're ready for
You
it.
guys, you guys did a wonderful job.
Thank you. Any other questions for me? Or input?
Well, don't hesitate to pull the trigger on the mask. That's what I say. I back you 100% on that. 100%.
Okay.
Thank you very much.
You're welcome. Reach out if you need me.
The black one is canceled, the veterans, bye-bye.
See you Tuesday.
Yes, see you guys.
Veterans will be here when they can get
One more quick thing for the council members.
Yes.
here.
We have, and I don't have a time yet, we have the Nationals at the Port Mission track this week, Friday, Saturday, Sunday. There are over 300 entries. Pretty strong number for Vigo County, so there are people coming from California and everywhere else. I'll get you, if we're gonna have an opening ceremony, I'll send you guys, I'll put it on the text or whatever, and let you guys know, because I'd like to have you guys, everybody's, the Indiana Sprint Week is at the action track tonight, and then tomorrow is an opening ceremony, hopefully at the Port Mission track, and then racing starts Friday, Saturday, Sunday. So for everybody in the room, it's free admission. It really is. It is pretty neat to see. I mean, you know, you're seeing future NASCAR drivers and everything else that are there. I mean, that's, you know, Jeff Gordon came from Quarter Midgets and stuff like that. So it's kind of neat just to kind of walk around and kind of see it and take it in, because it's where they start at when some of these kids are 5 years old. There's little itty bitty guys running around in little race suits, and yes, guys and girls, yes, thanks, Mickey. So yeah, so it's pretty neat. So there's,
It's
yeah.
into the same.
So anyway, just wanted to let you guys know that.
Thank
Everybody have a great day.
Thank you right after the treasures.
So my son was working as a tracer at the height of that.
Oh, really?
What do they
I'm gonna
do?
give you a test.
Actually,
I think he did.
I like that.
I put it all in alphabetical order and put, yeah.
Yeah.
So-
whatever makes
Makes more
more
sense.
I said by Marie,
I wish
I
her students
I
would.
wish Laura was last time, but it was more discreet, that's all.
I know.
She wishes her students would say.
Well,
I wish I would have stayed that hard. Last night I got killed in my class taking.
I'll share some.
My internet went out.
Because I'm not the sharpest guy, I have to do more preparation, so. So that's, I mean, to me, and I looked over this, and like I
And then
said
if you
last
make a
night,
change, just copy it automatically.
Somebody did.
So we had already, I wanna make sure I did this right. We dealt with one of those environmental positions in the spring, right? Didn't we?
And she came and presented for it, but we didn't act.
We didn't.
No, you acted on that.
You gave a raise.
I thought we did,
You
yeah.
acted on that, but this is, they're wanting it funded to
Just from a different.
Well, they wanna change which tab it comes out of, like which fund,
Yeah, it's a funding
because of
source.
the diminishing.
Okay, but it's already, it had already been, I thought that we had dealt with one of those positions, so. Completely crazy. Yeah, we have every Tuesday for the schools, we have COVID task force. And so we have people from the health department, from outside agencies, teachers, administration. I don't know, there's probably 20 some Zoom calls. And so we've been getting, it's been fascinating for me because I've seen the numbers weekly.
So when you say your son was one of those contact tracers, so what do they do?
So every day they would have that meeting, I think it was like 10 o'clock, and they would get all the cases and they would run like where they got it from. And then his job, or any of the tracers' jobs for them, like if you were listed, like if I had it and I said I was.
I had lunch with you.
Yeah, and, or I had lunch and we didn't have masks on, or we rode in the car to Indy together, then they had to contact you.
It sounds to me like a reality show there.
Oh, it was.
We never got contacted, obviously.
Yeah, well, so.
And
when
it
I
was not
got-
pleasant all the time.
When I got, when I thought I had COVID, but it was March of, let me make this right, March of 20. No, it's March of 20.
So when it first.
And so I had it early on, and so I went down to our farm, and I said, oh,
You might want to remember they're still alive.
yeah, that's fine.
I'm
Yeah,
gonna
and so
stop
I-
there, Corey.
And the thing about it is when I went down there and I called the health department and told them, I think I may have this. And they said, well, we're not gonna test you. There's not any test available. And don't leave your home.